Hey guys, we are talking about Shadowbans. Actually, hold up. Let me do this again. We are talking today about
Shadowbans.
community guideline violations and just some hacks and things that I found that have helped with TikTok and Instagram and things that I found to get around the algorithm blocking surgical content. And so let's get to it. LFG. Actually,
LFG.
let's go.
I'm the, I'm the, I'm the.
Just a brief history of me and social media. I started really on social media after the pandemic. I started after COVID. And before that, like maybe a year or two before that, not even, my first Instagram post on my doctor account was on the soap I was making. I still make soap. I make soap at home, and I'll show you that in a picture. I'll throw some soap up here in a second. But yeah, I've made all these. I put every antioxidant I can put in there, and I've never used Botox or anything, and I just make my own soap. So, for the people that are listening on audio, you can't see my forehead, but it's from my soap, I think. So that's the whole soap thing. So the soap thing was really not going anywhere. And so after the pandemic, I was like, let me just show some cases. Let me show some pictures of things. So I think I started showing cases and surgery cases and things late. The people that had done it 5, 10 years before me grew really fast. And I think the algorithm at that point was just catching up to the content and people could grow really quickly. And even since I started in the last 4 years, I've noticed it's hard. Like I've slowed down and others have slowed down, and it's people are flagged and banned, yet you go to your explore page or your for you page and you see some of the craziest stuff that gets through the algorithm, and you're like, why is my content flagged, and why can't you have checks in there? So for people that want to see surgery content, all they have to do is click a thing on their menu and say, yeah, allow it on my phone, rather than flag it for nudity and community guideline violations and things like that. So anyways, we'll get to some of that as we go. So yeah, I started a soap account. It wasn't really going anywhere. Those soap ladies, at the public markets are ruthless. And so I still make soap, but now I just pivoted into surgery, really. And so I think that worked out better. But yeah, so we'll get into that. And then what is a shadow ban? Yeah, that's a good question. So, what exactly is a shadow ban? A shadow ban has a sudden decrease in your reach and engagement. So, today, actually, I posted a video on a lip biopsy for diagnosis of Sjogren's syndrome, and it seemed like it got a lot of traction. And then a couple hours into it, it just kind of stalled. And so, I think I got another shadow ban. I feel like I'm continually shadow banned. On that account, actually. So going forward, so for my content and others like that show things like I do, my stuff is not going to be on the explore page. It's not going to be recommended to other people as far as, hey, you follow so and so, once you follow Dr. Wahan. That won't happen likely anymore, and it hasn't been happening. Drop in, when I show a post, I can go to my algorithm or the statistics and the insights, and it'll show you how many followers saw your post versus non-followers. And now typically every post is like 1% non-followers saw your post, and those are probably just from some random forwards. It's not from anything from the explore page or anything that Instagram's recommending. So that's why it's slow to grow. So it's frustrating because I like to teach. I teach at the University of Washington Dental School. I don't get paid to do it. I do it as volunteer, and I've been doing that for a while, since like 2009. So I kind of have I like to do it. And so even putting this stuff together, it's a grind. I'm a surgeon, I do what I do, but to put all this content all the time, it does take time, and so to do all that and have it just kind of get slammed as far as reach and things like that, it's like, it gets to you, right? So I'll show you some things that I kind of do to work around, but this is basically what this episode is about: how the algorithm keeps us down, and if there's anything we can do to help with that. So let's get to it. So this is a, you can search this stuff, and this is really just from something called Click Magnet, but there's so many people posting the same things. Social media people that say, hey, how to grow your account. You'll see I follow some of these people like Lucas O'Keefe and B Squared Social. They're good. It's just that if you follow them for a while, and I'm not ragging on anyone, it's just they're repurposing their content. So they'll put out something that says how to grow and how to do this, and then like a week or two later they'll put out the same thing. Maybe they'll change the font, the format, and something. And instead of a carousel, it's a one-page slide, or they'll do a reel on it. So they really just keep putting out the same, and they admit that they're doing that, just repurposing content over and over again to grow, using different hashtags and things. So this is just one of those people, I think. And so basically, they're saying don't repeat your content a lot. Of course, like I said, for people like that, that tends to work. But I think for people that are, getting flagged for violations, that might be trickier. Don't spam people or use third-party software or bots. So you'll probably get, messages on your DMs and your hidden DMs or whatever saying, hey, look, you want to get some followers? Here's some money, let us do this for you. And I'm going to say, don't do that. That's one good way to get your account flagged. And it's funny because sometimes, and I don't even know if that's true, even because I'll get requests, I'll get like followers from people sometimes, and I'll look on there, it says, oh, high priority follower. I'm like, oh, who followed me? Who's high priority? And so from, Saudi Arabia or something. Wow, he's got like, 57,000 followers. And I go look on his account, and each post, like 25 likes, no comments, 16 likes, no comments. I look at the reels to see how many plays, 116 plays on a reel from a year ago. So yeah, there's probably not real followers there, right? So, but Instagram told me on my account that this person is high priority. So I don't know if that works or not, or at some point they flag you, whatever. It still happens, right? So here's what a lot of people say. So they're saying it here, but basically, if you feel like you're shadow banned, like I actually feel like I am now, they say give it a rest. Don't post for a couple days. 1 to 2 days. 2 days is better than one. Don't post, don't comment on other people's posts, don't like stuff. Give your account a complete break. And they say this to do this to let the algorithm reset. So in the meantime, look at the hashtags you used on your last few posts. Look at the content. See if there's anything in there that's fishy that you think the algorithm could have used to ban you or punish you in a way, I guess. So that's something that most people agree on. Give it a rest and let the algorithm reset. The other thing they're saying is look at your old posts and remove things that you think are the reason. Like, are you commenting a lot on politics, on sports people that are, on the fringe, controversial people, Kanye, I don't know, whoever it is, those are the things that the algorithm, can get you for. Here's a good one. So this is funny. The banned hashtags. I suppose all of you know by now that there's hashtags that you can use, and if you use them, your post will get flagged, or you could get shadow banned, right? Or you get no reach. Banned hashtags. And this is funny because when I first started posting surgery videos a few years ago, I made up my own hashtag, dental extraction video, hashtag dental extraction video. And I was using that. And I kept kind of checking it to see if it was working. Like I would search dental extraction video and I'd go to tags and I would look for the tags and they would still come up. Now you do that, they don't really come up. Other people kind of jacked it and ruined it for me, I think. And then, so then now that's a banned hashtag. So I don't, you can't do that. So if I put that hashtag in my post, like Instagram will go, oh, your post sucks. We're not going to promote that. So there goes all that work you put in to edit your video, right? So now you gotta have to like search every hashtag you put in there, and it's not always a surgery hashtag. It could be the word always, like always. And the reason is because maybe a bot was using that hashtag for something and the algorithm flagged that. And just because they're flagged now doesn't mean they're going to be flagged in a week or 2 weeks. I literally search the hashtag OMFS, oral maxillofacial surgery, which everyone uses a lot. And it's been banned so many times. And literally yesterday I checked it, it was banned. If I put it in there, it wouldn't even find it. And today I put it in and it found it. So I don't know how soon they get unbanned or what's the reasoning, but this is what happens. So it's so fluid that you really, if you're going to put 20 hashtags in there, you should probably check them all. Like if you're really concerned about it. So that's how bad it's gotten, right? So some banned hashtags. OMFS, I checked today. It wasn't banned. I checked yesterday. It was. Bone graft. That's banned. Yeah, you hashtag bone graft. Did a bone graft. Yep, that's banned. You know what? I'll just say allograft. That's also banned, right? I did this awesome sinus lift. Sinus lift. That's banned. I did this really cool grafting case. Curry technique. Also banned. Okay, well, it's also called shell technique. Oh, that's banned too. So you get what I'm saying? I did this really cool guided surgery case. Guided surgery, that's banned. Yeah, so that's how bad it is. Like these hashtags can go from like being used a lot to, oh, you use it, your post is going to get drowned. We're going to drown your post. No one's going to see it. In fact, we're going to make it so no one's going to see your next 3 posts. You know, I don't know how they do it, but that seems like that's how it works. So yeah, check your hashtags. It's a big deal. This is an example that somebody sent me. All right. So this guy, you know, he's doing a great surgery, right? Like this is his post, and this is what you know, the text is: an asymptomatic 9-year-old with a history of mild painless swelling, noticeable rotation displacement of his lateral incisor. So this is a kid with some swelling inside the mouth. Okay. This post got flagged and banned. And I looked at it and I'm like, and at the time I was like, what is in this post? It's a kid. So a lot of things with kids, pediatrics, kids are going to get highly scrutinized on Instagram and so forth. So yeah, I wouldn't have probably said 9-year-old. I would have just kind of made the post without saying it, or maybe say it a different way. So yeah, I think the 9-year-old, and at the time OMFS was banned. And I checked today, and that hashtag is not banned as of today, but it could be banned again. So that could have been another reason. You know, the post is like, I don't have the pictures and everything, and also, you know, so there could be more to it. But anything with kids, like because they get into child trafficking, abuse, things like that, and I think the algorithm is ultra sensitive to that kind of stuff. Kids, politics, that kind of stuff, are hard to post about. This is another example. So this person, you know, posted something, and they appealed it, and their appeal was rejected. And so he's talking about sinus lift, you know, and that's a banned hashtag, right? So you can't say sinus lift. You got to say it a different way. Do you even lift, bro? Hashtag, whatever you want to use, you know, do what you got to do to get around that, right? So yeah, so that he used a banned hashtag. It could have been something more, but that's definitely something you don't want to do if you're doing all the work and you're, you know, people on social media showing their stuff. It's a select group, and for the most part, you know, they do like the interaction. That's why they're there. So it's like a biased group of people that kind of want to show their work. They also want to learn from people. It's a really quick way to learn procedures, technique, patient management, and things. So that's why people are on it. That's why people are on Reddit. That's why people are on these things, to get information and to give information. So you do all this work to show somebody or teach, and then this is kind of what you have to go through to, you know, to keep doing it. This is another one. This person had a post here, and they use the term guided surgery. So we've already decided that that's a banned hashtag, but he put it in the text. Also probably not a good idea. Right. So the SEO, things like that. So just be very careful. Right. So guided surgery is banned, but guided implant surgery is not banned. So, I mean, this is how minute you got to get into it. Like you got to go and search guided surgery. Oh, that's banned. What about guided implant surgery? Oh, that still works. I'll just use that one. So that's basically all I'm going to say on the hashtag stuff. But it is a lot. It is a lot. You guys still with me? This is going to be a fun one. Community guideline violations. Who's ever gotten one of those? Raise your hand. If you're driving, raise your hand. All the 10 people listening, raise your hand, right? Do you know someone who's been violated on the community? Whatever that means. So this is an example of things they don't allow. I mean, some of these ones are obvious. Talking about dismemberment in a non-medical setting. Yeah, that sounds nasty. Posting sadistic comments. Okay. Yeah, that I agree with that. Look at this one. The third one. Celebrating suffering or humiliations. So that's vague. This is a gray area, and I've been dinged on this, and it's not what you think. So celebrating suffering and humiliation, that's one of their community guideline violations that'll get your account flagged. So here's some examples that I got dinged for. So a few years ago, whatever it was, maybe 2 years ago, I did a biopsy video, and the audio on the video had a lot of hiss. It wasn't great. So like, oh, I'll put a song in the background. Let me just pick Miley Cyrus "Flowers." It was really popular. Just came out. I'm like, I'll just use that. And so I used that. I got flagged because I think I used Miley Cyrus "Flowers" on a biopsy post, and the song was kind of, it's a pop song. I don't think they like the combination of surgery with a song like that, or even a song. I mean, it's hard to say. So that got banned. I did another tooth extraction video. I was making a split on a wisdom tooth, and it was an incomplete split, and just the distal root cracked, and I got that out. And then, when you're doing a split, it's nice to get both roots split, but sometimes that doesn't happen. And so I got that fractured piece out, and then I just went in with another instrument and grabbed the distal root out, and that was fine. And then I just put a happy face emoji. Oh, it worked out actually just fine. And they didn't like the happy face emoji in the context of in a surgery video. So that's all it takes. So since then, I stopped using emojis in videos at all, unless it's, something so benign, but not a smiley face, nothing like that, because you don't want to have surgery with a funny emoji or a funny song, or, so those combinations are not good. If it's surgery, just show the video. Don't add a lot of stuff to it. That's what I found that works the best. If you muddy it up with a bunch of text and stuff, they're going to grab that text, and if they don't like something you wrote, even though you didn't mean it that way, they're going to flag you. So maybe just showing a video without a bunch of text. So I've been kind of transitioning into not doing that here and there now, and seeing if that helps. But yeah, I think that's how specific the algorithm can be. So song choice, emojis, things like that, joking around a little bit, not about the surgery, not about the case, not about the patient. But yeah, they don't like that either. So those types of combinations, So this is an example of what somebody sent me here. This is a case, looks, like a guided surgery case, banned hashtag. Example of a violation, and then this person appealed it, and you can do that, and this is so vague because you can just click appeal, and it doesn't really give you a lot of information, or they don't even tell you when they're going to accept your appeal or not, because you're like shadow banned in the meantime for who knows how long, right? So yeah, that's that. And this is me. So this is my page, okay? I felt like I've been shadow banned for like a month or two. And a couple months ago, I saw a dentist, I should say. I saw their page, and instead of like dentist or prosthodontist or oral surgeon, their category was video creator. I'm like, oh, that's nice, video creator. Yeah, I could do that. I had oral surgeon on mine. I'm like, you know what? It's been oral surgeon for a long time. Let me just change it to video creator. I create videos, and maybe it'll get me different reach, and maybe that works. So I did that, and I've been like continually like oppressed. And I was like, finally, like just this week in researching for this episode, I was like, thinking about it. And then I got flagged on my bio. So Instagram sent me a note and said, hey man, your bio is flagged, and we can't promote your account because your bio, got to change your bio. They don't tell me what in my bio, nothing. They just said, just got to change your bio. So I Googled it, and I'm like, video creator. So I went there and I got to Reddit, and this is from Reddit. And these are, what someone had already asked this kind of question. And on this comment, it says they probably detected it. This is some dude on Reddit. I don't know who these people are, but it's enough of an issue that, people are talking about it or trying to figure it out. They probably detected, the control, because maybe it's a porn bot that uses, the term video creator. So yeah, that could have been it. And so like, when I saw this, I'm like, yeah, I'm going to change my category back to oral surgeon, and which I did, and it's been oral surgeon now for about a day or two. But that's how crazy it can get. So just depends on what you put on there and what's in vogue or not in vogue at the time for the algorithm, I guess, right? So no more video creator, no. So, and this is my account here. This is how I get flagged, and I have so many videos, like hundreds, right? And it says what can't be recommended, and I click on that little orange thing that's, and you get to that, and it says edit or remove content, and then it'll have like 1 to 3 videos, and usually not more than 3 at a time. And then I'll click on that, and I'll show the videos. It won't even say the reason for it. It just says remove or edit them, and then we can recommend you again. So, I did this a bunch of times, and I'm like, all right, let me just archive them. So you can archive them, give it a couple days, and see if it resets your account. And for me, it doesn't, because I go back and those videos are gone. They're like, thank you. But they put up like a couple more videos to do. I'm like, really? I got to do more videos? And you do those and get rid of them on your account, and then they'll put up more. I'm like, this is not going to end, so just stop doing it. They're going to get rid of all my videos, and I'll be left with like soap and, a couple of headshots that I did over the past 2 years. And that's my account again. So yeah, I stopped doing it. I'm still shadow banned. So the only way that I can grow my account is if people forward my stuff. That's it. It's not going to go anywhere else, just so you know. So when you're watching my posts and you're watching these things, and if it helps you, like, comment, forward, do all the engagement things, that's the only way to keep it going. Otherwise, it's like a black hole. And I kind of dug a little deeper into the community guideline violations. So if you go on Instagram and you click on the community guideline violations, you're going to get into what they're, and it's still pretty vague, and it's still hypocritical, to be honest with you. So it says content recommendations here, and they're talking about fighting. Like, oh, if you have fighting in there. I'm like, are you kidding me? You know how many videos on fighting are on Instagram on the Explore page? Like if you click on the Explore page and you just go and you go, oh, there's somebody fighting at a Raiders game in the stands, which they have videos of this, right? Stuff like this. You click on that and you watch like, oh man, that guy got messed up. And then you click off of it and you keep going down. You're like, oh, now there's like more videos of fighting on, because you clicked on the one, right? They have fighting on there, yet it's not a community guideline violation. It's on the Explore page, right? So they say this, but that's literally not true. I mean, as far as I'm concerned, it's not true. Yet surgery stuff, that is true. They won't do that. See-through clothes, they say on here. Oh, you can't have see-through clothes. Are you shitting me? Go to your favorite Instagram model's account. Go click on it or find an Instagram model. Go to their account and just do this and just look at it and keep doom scrolling. You're going to see-through clothes. They're not blocked, right? So they say this crap, but it's not true unless it's surgery. Right. So that's what's kind of gets me sometimes. I'm like, yeah, whatever. You still keep all that stuff there. You can go to your, within the guidelines, there's sensitive content control. So you can go in your menu on your phone, and then there's a slider on there where you can have it show you more sensitive content stuff. You still have to click something to see that, but it'll show up a little bit more. So I always put mine on max, and you can go in your settings and do that. And I'll show you how to do that on the screen. But that's one way to do that. So I'm going to try to do that here in real time. So if I go to my iPhone, which I have an iPhone, and I go to my Instagram page, and I click on the three dots or the three lines on the right corner, that takes me to settings and activity, right? So if I scroll down from settings and activity, and I get to, let's see here, content preferences. So if I scroll down on settings and activity and I get to content preferences, so let's find content preferences here, click on that, you'll see you can reduce fact checking. You can do that. So if you click on reduce fact checking, you can put on don't reduce by default, or reduce more. So you can have a slider for that. And then sensitive content. If you click on sensitive content, you'll see you can show more, standard, or less. I always have mine on more. I don't know if it does anything, but there's a little slider they put in there for people that want to still see this stuff and not have it, through another extra filter or hoop to go through. So that's helpful. All right, so we got through shadow bans, community guideline violations, all those things. So how do you help people like me? How do you help me? People that are shadow banned that put out stuff that's useful to you and you still want to see it, right? So what they're saying is what I can do and what people like me can do is maybe to get more reach is if you're putting a picture up, when you're editing it, you can use alt text. So there's an option in there to edit, and then you click on alt text and you can describe your photo for people that can't see very well or things like that. So supposedly that helps you get more reach with photos and things. I haven't figured out how to do that with videos. I'm not sure if you can, but with photos you should be able to do that. They're saying here also, and this is from Zoha Khalid, but a lot of people are saying the same things. I just picked somebody at random, but all this stuff is very similar among people that post this kind of stuff. You want to strike a balance between informative and sensitive content. So don't post a bunch of videos in a row. Maybe a couple videos. Maybe you on a yacht. A couple videos. Maybe you in a see-through shirt. I don't know. That'll get through the algorithm. I'm sure it will. But yeah, stuff like that. Maybe a couple of videos, you in a hot tub. How's that? Something like that, right? You get the point. Alternate your awareness posts with casual, non-controversial content. Kind of the same thing. Just kind of keep it moving. So yeah, alternate your videos with casual content, that kind of stuff. So those are ways to do it. And this kind of talks about hashtags, and it says use a mix of hashtags, relevant hashtags, things like that. And the biggest thing is actually just researching the hashtags. Search them yourself. You can go to a site called Meta Hashtag, and I'll put it up on the screen. And you can put your hashtags in there, and then it should be able to tell you if they're banned or not. I think it's reasonable to do that because you can put a bunch of hashtags up there at once. And it may tell you if some of these are banned. So that's something that you could do as a batch. And I think that's helpful. Okay, so let's get to the fun stuff here. This is my TikTok page. Yeah, I'm on TikTok. I'm on YouTube. I'm on Instagram. I'm on Threads, which I don't do much on Threads. What else? I think those are the main things that I'm on. But yeah, so this is my TikTok. TikTok is different. It's just different than Insta, right? So I can't post what I post on Instagram on TikTok. If I post a wisdom tooth extraction video in color on TikTok, it'll get blacked out 100% of the time. And it's not even as if you didn't make it. It's like they punish you. You'll get negative views and then you might get flagged. I got to the point where I just posted a couple surgeries in a row, and I got to the point where TikTok sent me a note, a letter, an alert saying, hey, one more violation, your account's deleted, man. I'm like, so from then I was like, what do I do? So I was trying some stuff. And so what I found that works on TikTok, and actually does work on Instagram, not as much, but it does work, is when I make a surgery video on TikTok, the same video I post on Instagram, I will go through my video settings and take out the orange and the red color. So you can go in your video settings and then slide down all the way the orange and the red. And it's black and white video, except the orange and the reds are black and white. You can still see blues and greens and other colors and yellows and things. But I know it's not a completely color video, but it has some pop. It has some color in it. So that's what I found to get around that on TikTok. So you can see here on my TikTok page, what's actually also funny is on the upper right, you see this one video, this guy's mouth. It's like a 10-second video and it has like 2.8 million views. And it didn't get flagged. There's no blood in it, but this guy's injury is like 5 days old and he's got like gravel in his mouth. So it's nasty, but it didn't get blacked out. And it's still there. And it's got 2.8 million views. And even you could doom scroll through the comments on this video all night and just, they're bad, but they're funny. So that one actually didn't get flagged. But if you go down my page, you'll see there's blocks of black, right? And there's that black and white video that showed up right there. But every color video or anything, even some black and white, get banned after some point. I think the same thing happens with emojis. If I use a smiley face emoji for something, that's gonna get censored. So, or the Karens, the Karens will censor you too. So again, how do you support creators who've been shadow banned? I kind of went through that. Engage with them, share their stuff, bookmark it, comment on it, like it. You need to do all the things. And how do you know that they're posting if Instagram's not putting their stuff out on your feeds? You can follow them and favorite them. So on your Instagram, go to the word Instagram on the top of your phone, click it, and you'll see a thing called favorites. So what that is if you go to people that you follow and you like them and you click on the little dots on their post, you can add them as a favorite. So when they post something, it'll show up on your feed, or you can always select to do that. So stuff like that is helpful. Forwarding the stuff, I think forwarding and sharing with your friends and colleagues is the most important thing. I think that's the biggest way for people that post surgery stuff who are continually shadow banned to increase their engagement and their reach. So if you're just, I know you guys are all busy, But stuff like that really helps, and it shows that what we're doing is helpful and you're getting something out of it, So thank you. All right, we're going to end it with this. This is a paper that I found. It's actually really interesting. This is a paper called Content and Engagement Among Plastic Surgeons on Instagram. So someone wrote a paper, and this is, from the Aesthetic Journal of Open. It's an open forum in the Aesthetic Journal. This is from 2023. And this is super interesting. So this is the abstract, basically. Patients routinely use social media to locate providers and review before and after photographs and discuss experiences. The objectives are discussed and the methods, from February 2022 to identify the top 10 global plastic surgeons on Instagram and rank them. And their last 20 posts were analyzed. So what they did was they looked at these posts of these top 10, plastic surgeons globally to find out what is their most engaging content, what is causing people to like, follow, subscribe, all the things to these people. Is it their before and afters? Is it their, personal pictures and photos and videos? Is it surgery stuff? And so that's what they looked at. And so out of 200 categorized posts on Instagram, marketing posts had the greatest presence. So most of these people are posting stuff about marketing. Yeah, buy my face cream. You've seen Tony and you've seen all these people, right? All this stuff. Yeah, they put that on there because they want to sell it. But the highest engagement was personal stuff, like even probably little skits, right? That's why people do skits, right? I should probably do skits, but I don't. So stuff like that, personal stuff, like, hey, I'm at dinner. Hey, look at me at dinner. So things like that work. I think when you get to that level, that really works. If you got 20 followers, no one wants to see me at dinner, right? Yeah. So I don't know how accurate that is. These are top 10 global surgeons or whatever. Yeah, people probably want to see what they're eating, but if you're, putting out the same kind of content and you got 26 followers, I don't think that's going to hit the same, right? It's going to hit different. So personal content had the highest engagement. That's what this study found. So I need to probably show more personal content. I'm not huge or anything, but I know I don't do a lot of it. And I think I'm just pretty private. But you can see that does make a difference for people. And there's a study showing that it does. So yeah, so basically it's kind of saying this. I'm thinking this is kind of biased towards established surgeons because new accounts, I think it's nice to show pre and post pictures, things like that to get your account going. Then maybe once it's rolling, personal stuff is helpful. So I think this is it's an interesting study. But it makes you think, right? But that personal stuff is a big deal. So here's the other thing. So these accounts with big social media followings, like I said before, Tony Yoon and all these people that post, they get a large following. What that also does is it helps your SEO, right? So your search engine optimization. So you're going to be ranked higher on Google searches, things like that. So your stuff will show up high on the page every time. Social media is a big part of that. If you have large social media accounts, multiple accounts, things like that, you're going to be up there a lot. So it's just it's like a little thing it's like a little cycle that keeps going, right? So all that really builds and builds, and it helps in a lot of ways. So yeah, that's basically it. So I hope you guys got, some information and some insight into what I do and what others do, and, the grind that it is to put out content continually. And I hope you understand that, I do it, a lot of it's just on my own time, right? I'm a surgeon. I work and I do things, but stuff like this is also fun. But it's also fun to see that your work is, that it's helping people and they show it. And, that's also a huge drive for what people like us do. So all I want to say is, thank you for watching. And if you're new to the podcast and you're listening on an audio platform, find the video, because this is a video heavy podcast sometimes, and not in a bad way. I'm not trying to lecture people, but sometimes you need to see things. I don't want to have to describe everything, which I totally can, but find me on YouTube, Spotify, Apple. Those are all video. All the other podcast places, you're probably gonna have me on audio, even on Amazon. Ask Alexa, Dr. Juan Experiment. It's on audio, so you have access to it at a lot of different places. So thanks again for coming out, and I'll see you on the next one.